And hello, Malika. Today, as I'd already mentioned earlier, we are starting a series on interviewing our patients who've been successful, and we want to hear from their own how the journey was and what they felt about the entire fertility treatment. So today we have Malika with us. Thank you so much, Malika, for taking your time out and agreeing to be with us. And so before we start asking you about your fertility journey, please tell us a little bit about yourself and your babies.
Thank you so much, doctor, for giving me this opportunity. Let other people also know that this journey is a little hard but very beautiful. The result in the end is very beautiful. I am Malika Ghule, and I'm a mother of triplets, thanks to Dr. Kaberi Banerjee. I am a professional and I own a preschool. So yes, my journey was comfortable enough and I could take care of my work as well as my own health.
Wow, that's lovely. That's lovely. So, Malika, before you came to us, you had undergone some fertility treatment, right? Can you tell us a little bit about the past fertility treatment that you had before coming to advanced fertility?
Okay, why I came started with IVF is because I was detected with endometriosis. I was emotionally low because I thought it was very difficult for me to conceive, and probably I would never have the blessing of being a mother. But when we came to you, so I came to you know through my gynac. My gynac in Pune suggested about Dr. Kaberi, an advanced fertility center, and she said, I know that you might really get help there, and that's how we came to you. And then things just worked out the way they were supposed to.
Right, right. So while you were describing your previous journey, I think we lost connection. So if I'm right, you had about 6 IVF cycles earlier, right?
Yes, we I had 6 IVF cycle failed attempts of IVF
Right.
before we came to advanced fertility.
Right, right. And I
Mm.
do remember we got success in the second attempt, right?
Yes, yes.
Okay.
So I remember when I came to you, I was emotionally drained. I was physically drained because I was like, this is something, and my profession is wherein I work with children. Sorry for that. So I work with children. So I was always amongst children. I would always say to myself, why am I having this issue? Which most of the people face, when they're trying to have a baby. And somehow when we went to advance, first, I really liked the approach of the doctors, the staff, and of course that you were so comforting.
So there seems to be some electricity problem at Malika's end.
Yes, yes. Can you hear me now, doctor?
Yeah, yeah, you carry on. Let's continue with the audio. Yeah, yeah, now it's fine.
Yes. You were the one who was like, let's try our best. And, if everything works out, we will, make sure that you will be a happy mom when you leave. So, yes, I had a very nice experience with advanced fertility. And you and Dr. Bhavna were very supportive. I remember, I used to be so worried that Doctor, will it work out? Do we have to look for more options? But you were all like, stay calm and let things be the way they are. We'll work through it. That's our duty.
Right, right. I think That's important in the fertility journey, Obviously, it's a huge, apart from time, financial, it's a huge emotional, psychological stress to go through these treatment. And I personally
Right.
feel a little bit of hand holding during the treatment journey makes it a wee bit easier for the couples to kind of go through it. And usually, as you know, in most of the cases, we are able to get it right. So, yeah, thanks
Yes,
for
yes,
acknowledging that. Means
yes,
a lot
yes.
to us.
See, doctor, when you speak from a patient point of view, what we look for is a doctor who just comforts you and says, calm down, things are going to be okay. And trust me, because even if I think of my journey, I think it wouldn't have been easier if I would have gone somewhere else. That's why I want to share my experience with everyone, because sometimes it's all about just holding your patient's hand and say, okay, don't worry. We'll see. Leave it on us. And sometimes all that is important. That's all matters for a patient, that okay, the doctor is there for you. So
Correct.
yes.
Correct. Thanks once again. Now, tell me one thing, Malika. You had taken those injections, and we have many couples who worry, who before starting IVF, they read a lot on the internet. We can't blame them because that's where the information is. And they hear a lot about painful IVF, bed rest in IVF, having to leave work in IVF. So, what was your experience? How painful was it? And were you continuing with your life, or just share a few things on this topic?
So see, initially when you start with the treatment, any woman, because this is something new, and so yes, you are anxious. I, as a mother, also, I mean, as a profession, I thought, oh my God, will I have to stop going to school? Can I not go for work? But it is not that painful. First, yes, it is a tiring journey wherein you have to go for your injections those 10 days. Then you have some medications that need to be taken at home. So yes, I would say you just have to be particular about the time of medicines or the injections that have been prescribed to be taken at home. The same time, I think that really helps, is what we also spoke about. And it was just that I was just making sure I was taking my medicines on time. I was taking the injections that were given to me, or if I had to come to the clinic, I was making sure everything was done in time. I was just organizing my life. And once that was done, it wasn't difficult for me to work. I was working, I was coming for my injections. So my life, frankly speaking, did not get affected. So no, it wasn't painful.
Mm,
Yes, sometimes it's just the fear that makes the injections a
correct.
pain. But once you're at ease, it's not painful.
Right, right. These are very important, I think, coming from a person who's gone through it to, a doctor saying that no, it's not painful, but for somebody who's gone through it saying that it is painful to a certain extent. But like you said, if you organize yourself, if you know what is to be expected, then it just makes the journey easier, isn't it? So now finally, Malika, tell us a few
Yes, true,
tips,
true.
a
It
few.
just makes it easier.
Sure. A few things, one or two points that you would like to tell to our listeners who are suffering from this infertility journey. What would you like to tell them as a person who's gone through it many times and finally you're successful? What is your message to them?
So I would like to tell those mothers or those parents, you just have, you just need to find the right doctor. And if you're at advanced fertility, trust the doctor. And see, end of the day, everything depends on God. So when the time is right, everything is going to work out. And somehow it did for us. We had our triplets after 7 years of our marriage. And I remember that, we used to like, oh, it's so much, I mean, it's been so long, and then, family pressure. But then, when things worked out, it worked out for good. And I feel that, probably this was the right time. where, we had the babies. We were professionally doing very well. We were mentally, ready to have a baby. So yes, when the time is right, everything is going to work out. Just leave it to your doctor and leave it to him. I'm sure everything will work out. And trust me, um, I have been there. And today, when I'm sitting here as a happy mom of three beautiful, beautiful girls, I know that, it has to happen when the time is right.
Correct, correct. Thank you so much, Malika. Thank you for your faith and trust in us, for voicing your opinion, and it means the world to us. And I wish you, your beautiful family, the very best in the future. Thank you once again.
Thank you so much. Thank you so much, doctor. Thank you so much.
Right.